morning, sir. My name's Ariel. I'm going to be your nurse today.
How are you?
Good. How are you? What's your name?
Johnny.
Nice to meet you. What's your birthday?
August 3rd, 1984.
Okay, and where are you right now?
The hospital.
Great. And what year is it?
2019.
Okay, and who's our president?
Donald J. Trump.
Good. So this patient is alert and oriented. At this point, I would look and make sure that he has an ID band on that shows his name and his birth date that matches what the patient says. If the patient was a fall risk, I would make sure that he has a fall risk band on. He currently is not because he's ambulatory, young, and has no history of falls. I also would make sure that the bed is in the lowest position, that he's safe, has at least 2 side rails up, and knows to not get up by himself. Make sure he calls before he gets up. Okay, so I'm going to do a quick neurological assessment on you. Just need you to squeeze my hand as hard as you can. Very good. Okay, I'm going to check your pupils. Good. Okay, stick your tongue out for me. Good, and give me a big smile. Okay, so at this point the patient's neurologically intact. By checking his tongue and his smile, I'm making sure that all of his teeth are intact, his mucous membranes are moist, and that his tongue is midline. He doesn't have any neurological deficits there. Both of his grips are equal and strong, and both of his pupils are equal, round, and reactive to light. So I'm going to move on to musculoskeletal. So at this point, can you just point your toes up towards your nose? Good, and push down like a gas pedal. Good. Can you take this leg and flex it up? Good, and extend it back. And that one. And extend it back. Very good. Okay. Are you in any pain today?
Yeah.
Okay, and where's the pain?
Left side of my stomach.
Okay. If you had to give it a descriptive adjective, what would you say? Aching, dull?
Very sharp pain.
Okay, and from 0 to 10, how bad is the pain?
8.
An 8, okay. So I'm going to move on to cardiovascular assessment. I'm going to take a listen to his heart at the API point. Okay, sounds excellent. I'm going to check all of his pulses, check both the radial pulses to make sure they're equal. Good, they're +3 and equal. Check both his pedal pulses. Okay, also +3 and equal. And his posterior tibial pulses. Very good. Okay, there's no edema or swelling anywhere. His legs look good, his arms look good, all of his skin color is good, capillary refill is excellent. So I'm going to move on to your lung assessment. Patient is currently wearing oxygen. When his vitals were taken before, he was breathing shallow because of the abdominal pain. So we had to put him on 2 liters nasal cannula. Now he's statting about 97. Okay, take a deep breath for me. Good. One more. Good. Okay, and if you could sit up for me. Good. One more. Good. Okay. Have you been coughing at all?
A little bit.
Okay, does anything come up with the cough?
Nah.
Okay, and is it painful when you cough in your lungs at all?
Not in my lungs, but yeah, I still get that sharp
Still
pain.
get the abdomen pain.
Yeah.
Okay. So if you could just lift up your shirt a little bit, I just want to take a look at your stomach. All right, so his stomach looks good, not distended at all. I'm gonna take a listen. Okay, just make sure you have some bowel sounds going on there. Do you remember the last time you had a bowel movement?
Like an hour ago.
Okay. And what was it like?
Still like diarrhea.
Okay, you've had diarrhea?
Yeah.
For how long?
Probably like past 2 days.
Okay. Any blood in the stool?
Nah.
Okay. And I'm just going to push down. You can put your shirt down. I'm just going to push down and you tell me if you have any pain. No.
Not right
No.
there. Yeah.
Right
That side.
there. Okay. Have you had any nausea or vomiting?
A little bit of nausea, but no vomiting yet.
Okay. How long have you eaten anything today?
Yeah.
Okay, and you've been able to keep it down. Do you get nauseous after you eat, or are you just nauseous all day?
Usually it's like before I eat.
Before you eat, but you're still able to eat food.
Yeah.
Okay. Have you had any issues urinating?
Nah.
You can control your bladder completely, no incontinence.
I can control it still hurts when I, like my side when I do it, but no issues.
No issues with it. Okay. If the patient had a Foley catheter, I would make sure that it is secured properly to his leg, that it's hanging below the bladder, that it's dated, and inserted all properly cleaned. Do you have any rashes or suspicious moles, anything like that?
No.
No. Okay. I would check the patient's skin turgor to make sure that he's not dehydrated. And it looks good. I would also check and make sure that the patient's IV site is correct. It's clean, dry, and intact. There's no redness, no swelling. There's a date on it. It looks good. So at this point, that's it.